Opposition to a Massachusetts congressman's plan to blow up a key portion of the popular federal employees' health benefits program is spilling over into Northern Virginia, an area with one of the nation's largest concentrations of civilian federal workers and retirees. I'm Wayne Lexington, reporting for RxRoundtable.org. Northern Virginia's federal workers are voicing strong opposition to a plan by Representative Stephen Lynch of Massachusetts that would scrap their FEHBP drug benefit plans and replace them with one similar to the government's Medicaid program for the poor. Lynch's plan drew a strong rebuke from FEHBP beneficiaries at a recent Fairfax, Virginia focus group, where panel members warned that federal workers would likely vote against a member of Congress too closely aligned with any plan that limits their drug and health plan choices. Lynch's legislation would impose strict government price controls on drugs, and in doing so, experts say, severely limit drug benefit choices for federal workers. Lynch disagrees with the assessment, but the government agency that runs the federal employee health benefits program opposes the legislation as well. Reaction to the Lynch legislation has been overwhelmingly negative, with a poll of Washington area federal employees, conducted in early March, showing strong majorities opposing the bill and greater intervention by Congress in the FEHBP, a program government workers say they are overwhelmingly satisfied with. Comments by focus group participants mirrored those of federal workers in the poll, where beneficiaries took strong exception to Lynch's comments last month that the FEHBP's drug benefit plans were overly complicated and should be dismantled. Focus group participants, all from Fairfax and Prince William counties in Northern Virginia, also predicted that as more federal workers learn about the Lynch bill, the higher the likelihood the issue would become a political liability for the bill's supporters in the 2010 elections, especially in areas like Northern Virginia.
Mr. Congressman, my advice to you would be that you don't want to support anything that's going to have the effect of reducing choices.
If I choose to pay more or less or go with one company or another, it should be my choice, not the government's.
Listen to the people and kind of leave well enough alone. The program that we have now is awesome.
The group also unanimously cautioned incumbent members of Congress against making big changes to the popular FEHBP drug benefit offerings. As one veteran federal worker said, "If it ain't broke, don't fix it." For RxRoundtable.org, I'm Wayne Lexington.